It makes them sick. In adult studies, same thing. We found there's not many of us normal weight adults left anyway. I'm a minority in America because almost 70% of Americans are overweight. So I'm normal weight, but I'm an anomaly. But of the thin Americans, almost 1/4, 1 in 4 thin Americans also have this problem, also have diabetes, because their diets are so poor that they're fat on the inside, not on the outside. This is a patient of mine I want to tell you about, because in medicine we think, okay, you have a bunch of conditions, we can manage them. You have heart failure, you have diabetes, you have angina, you have these high blood pressure. We can manage these diseases with drugs and hopefully prevent you from having bad problems. Nobody thinks, oh, I'm going to take somebody who's 63 like this patient of mine, George, and I'm going to reverse all these diseases. Nobody thinks it's possible because they don't see it. Now, he had type 2 diabetes. He had ischemic heart disease, angina. He couldn't walk without chest pain. He had high blood pressure. He had sleep apnea. He had very bad cholesterol, which is the kind you see in diabetes, small HDL and LDL particles. He had a fatty liver. He had reflux. He had low thyroid. He had chronic inflammation with sinus problems. His prostate was enlarged. And he had low testosterone and sexual dysfunction. A lot of problems. He was on 9 medications for all these different conditions. 9 medications. And he was going nowhere fast. He was going quickly to his grave. He said, Dr. Hyman, can you help me? And I said, yes, but you have to do everything I say. Now, most of the time he went to the doctor and he saw a different doctor for every one of these problems. And each treated him with a different medication. He went to a different specialist. Or the doctor says, oh, we can only deal with this one problem today. This is the opposite of functional medicine. In functional medicine, we want to know everything. We want to know all the variables. We want to look at every detail of your history. If you have an itchy toe, that might be important. You know, if your ears itch, that might be really an important clue. It doesn't matter that it may not seem related to your main complaint, because the body is an integrated system. Everything's connected. And our job is to understand those connections. Functional medicine is a way of thinking that helps you understand those connections and those patterns that exist in biology that up to now, for most of us, have been invisible. Functional medicine, by using the matrix, the Zhuzhen, the matrix diagram, which you hopefully will be able to be skilled at. You're going to learn more about how to use that this afternoon in a workshop with Christy. If you use this with your patients and begin collecting data and organizing it in this way, you'll begin to see these patterns emerge in the story of your patients. This is very important. Now, what we do in functional medicine is we don't treat the diseases. He had so many diseases. If I treated each one, it would be too difficult. So, in the same way, this is a... People think, what is this? People say, oh, this is a bird sanctuary, or something like that. But actually, this is a fish farm. As I mentioned, this is a fish farm in Spain where they grow fish not by trying to feed the fish and trying to stock with lots of fish. Naturally, by creating a healthy ecosystem, the fish come, and then they harvest them. In the same way, we can create a healthy ecosystem in the body by creating balance, and disease goes away as a side effect. We don't have to treat all the disease individually. So we treated the system, not the symptoms. We treated his whole system. So we used food, and we gave him a whole food diet, a low sugar diet, high fiber diet, lots of colorful fruits and vegetables. And we gave him exercise, starting off very slowly because he was very out of shape. We gave him some basic nutritional support to help deal with some of the issues he had. A multivitamin. We gave him omega-3 fats, which helps triglycerides, helps inflammation, fatty liver, diabetes. We gave him vitamin D, chromium, which is good for diabetes, and lipoic acid, again, a very important antioxidant. And we gave him support from coaching, from our nutritionist, physician, and so forth. And after a year, he did tremendously well. He lost 155 pounds. And now he's almost 60 years old, 70 years old, and he's starting a new business. He feels wonderful, he feels healthy and happy, and he has no more problems. His glucose tolerance test went from normal, very diabetes, and his insulin was very, very high, went to normal. Everything went to normal. All his angina, diabetes, high blood pressure, cholesterol problems, sleep apnea, reflux, sexual problems, everything went away on no medication. This is the power of using these interventions. They work, and they work better than any drug. So let's talk about the matrix and how we can look into the matrix and understand heart disease and diabetes and insulin resistance in a slightly different way. So we want to understand medicine differently, and the way we do that in functional medicine is we use the lens. It's like putting on new glasses. We use the lenses of the matrix. So we look at all the different aspects. We look at assimilation, defense and repair, we look at energy, we look at detoxification, we look at transport, communication, structural integrity, and we look at how lifestyle intervenes and affects these things. We look at your genetics and your predisposing factors and triggers in your life that may have created imbalance. And we want to see where the imbalances are. And then if you look deeply into any disease and you use the matrix as a filter, you begin to see how these different factors all relate. Because just because someone has diabetes doesn't mean that all diabetes is the same. For example, I had a patient who had diabetes. She was a very skinny lady. She exercised all the time. She ate a healthy diet. Why did she have diabetes? We tested her. It turned out she had mercury poisoning. Mercury was poisoning her cells, causing diabetes. We got rid of the mercury, her diabetes went away. So it may not be necessarily what you're eating. Another patient could have problems with his digestion and toxic flora that create inflammation in the body, and that could cause diabetes. Anything that causes inflammation, that's a very important point, anything that causes inflammation will cause insulin resistance. Doesn't matter what it is. It could be a food allergen, could be a toxin, could be stress, could be gut flora, bacteria, could be nutritional deficiencies that lead to more inflammatory states. All these things cause insulin resistance. And then insulin resistance causes all these other problems that we diagnose. So let's look at the matrix. And we have to sort of expand our view of physiology and understanding this. So let's first look at this matrix. And we can see here, this is the matrix diagram we use. I use this every day in my practice. I've been practicing medicine for 20 years. Functional medicine for 20 years. And I use this every day because this is how it helps me to organize and collect data and to think differently about a patient. What is the problem people are having with each of these areas, and how can I fill this in so I can see a complete picture very easily, and then the diagnosis pops up. Then I know exactly what's going on. Maybe they have more problems with energy and biotransformation, or maybe it's more about assimilation and defense and repair. Maybe their gut and immune system is the problem, or maybe they have some other issues here, hormonal problems. These are really helpful to me. So you have to look at what are these imbalances. And these are really straightforward. We can identify what these are when it comes to diabetes. And each of these areas has an imbalance. In fact, diabetes can be caused by problems in any of these areas. And then we can use lifestyle and nutrients and sometimes medications to alter this dynamic. And we look at their basic predisposing history, family history of diabetes or heart disease. If you have a family history of heart disease or diabetes, even cancer, obesity, you could have a risk for it, and there may be genetics. Also, I just want to say something about genetics. You might have a genetic predisposition, being Asian, to type 2 diabetes, but it doesn't mean you're going to get it. In fact, they've really looked for the diabetes gene and the obesity gene, and they really haven't found them. There are 32 genes that identify your potential risk for obesity. If you have all 32 genes, your weight increase risk is only 22 pounds. It doesn't explain what's going on now. Those only affect less than 10% of the population. There may be triggers that are causing this problem to get imbalanced. It could be stress, it could be sugar in your diet, it could be poor diet, toxins, sedentary lifestyle. And it could be that you've got all these mediators that are happening that are driving this. Stress levels go up, cortisol go up, toxins, and so forth. So let's look at how we develop heart disease. Well, we have plaque developing in the arteries. We have foam cells that are forming because of the bad cholesterol. And the only cholesterol that causes heart disease that gets deposited in the artery is oxidized small LDL particles. So you have to have two things. You have to have small LDL, and you have to have oxidation. Oxidation or oxidative stress is a result of poor diet, of chronic stress, of environmental toxins, and many things that cause oxidative stress. A lack of nutrients, so too many free radicals. And then your immune system kicks in. This is an inflammatory process. So we now know that heart disease is an inflammatory disease, just like rheumatoid arthritis. And you get endothelial dysfunction as a result from the insulin resistance. And that leads to hyperglycemia, causing increases in this endothelial dysfunction, where you get smooth muscle dysfunction, you get stiffening of the arteries, and you can actually measure this with various devices. I don't know if, James, you know about these, but there are different devices you can use that measure your pulse wave, and you can see very early if there's large and small vessel dysfunction, even before you see any pathology. You'll see dysfunction in the activity and the elasticity of the arteries. In fact, if you use ultrasound technology, you can, with one bad meal, you can cause stiff arteries. If you have a big back and fries at McDonald's, you'll see your arteries immediately stiffen up. And this happens very quickly. So also, let's start looking at the matrix with diabetes and insulin resistance. Let's look at how toxins affect us. So there's a lot of toxicity that can be related to insulin resistance and hypertension and heart disease. We know from the data that people who have high exposure to environmental toxins, this seems to be in patients who've been exposed to toxins have a higher risk of diabetes. And you can look at serum GGT, which is a liver enzyme, as a very early indicator of toxic exposure. I would encourage you to test this. It's often part of a liver function panel, but not always. Is it part of the liver function panel always here? Because we have to add it on in the United States. But it's a very sensitive what? Always included. Always included. It's a very important indicator of fatty liver. Also, ALT is an indicator of fatty liver, and GGT is a very sensitive indicator of exposure to environmental toxins. So if you see a patient with a high GGT, you know they may have had exposure to toxins. This is even more frightening to me. BPA. Does everybody know what bisphenol A is? Has anybody heard of this before? Bisphenol A. This is a chemical that's been used for years and years and years as a plasticizer. It's inside cans. So if you have canned food, it's in the cans. But it's also, if you get your ATM receipt, it's on the receipt. If you go to the gas station and you get your receipt from the gas machine and you get your credit card receipt, or when you go to a dinner at a restaurant and you get your receipt from the credit card machine, it has bisphenol A. You're getting it through your fingers. Everybody has this in their body. And it's very dangerous because it increases many problems. One of the things it does is it increases insulin. This is at very low doses in human islet cells. So in pancreatic cells, it increases insulin at a dramatic rate at doses that are nanogram doses. Very, very small doses that are far below what most of us are exposed to every day. So here's an example of something you may not even be eating. It's not like you're having a Coke, but you could be exposed to a chemical that's triggering insulin resistance. Arsenic, we know, increases in arsenic. There's some natural arsenic in the water. Arsenic is in chicken feed. It's in rice, the way that sometimes in the soils, it's in the rice. So it's in the soil, it's in the water, and it's in our environment, and it can increase your risk of type 2 diabetes. Mercury, lead, cadmium, these all increase high blood pressure, increase diabetes. This was a study I was very surprised to see at a journal Circulation. They looked at blood levels of lead and all-cause mortality, as well as heart disease mortality, right? And this was fascinating. Now, normally in America, the level for lead that's considered safe is 10 or less. In this study, they found that anybody with a level of 2 or greater, as low as 2, had a dramatically increased risk. In fact, a 55% increased risk in heart attacks and heart disease, an 89% increased risk of having a heart attack, and 151% increased risk in stroke. And this affects 39% of the population in America. I would bet you that in urban populations in China, that it's much higher than 39% because of the pollution and the coal, which releases lead and mercury into the air. So you should check your patients for lead, but what cardiologist is checking their patient for a lead level? These risks are increased, are perhaps even greater than you get from a high cholesterol level. Everybody's checking cholesterol because you can treat it with a drug, but really we need to be looking at other factors. So what's interesting to me is that we have pharmaceutically driven medicine. It's not based on science. This is a study that was in one of the most prestigious cardiology journals in the world, and yet nobody's talking about it. Nobody's prescribing that we should be getting national standards for lead measurements in heart patients, that we should be treating these patients with chelation. Nobody's talking about this at all, but this is a very real problem. Now, the source of heavy metals, again, is industrial pollution, it's agricultural techniques, it's coal burning. All these things lead to this vicious cycle of heavy metals in the environment. And there's associations between many toxins and diseases. So not just heart disease, but also ADD and allergies and Alzheimer's and immune system problems, autism, kidney disease, cancers, all can relate to environmental toxins. And even things like, obviously, fertility issues, xenobiotics, which you probably heard about from Bethany, which are hormone-like reactions from these toxins, cause significant risk for infertility. And of course, in heart disease and diabetes, we see arsenic and BPA, or bisphenol A. We see pesticides, PCBs, PVCs, dioxin, vinyl chloride. These are all things that are prevalent in the environment, and they're causing problems in our health. So learning how to help your patients detoxify, learning how to reduce their exposures is really important. There's no way we can eliminate our exposure completely to this, but we can reduce it. And we can reduce our exposures, and we can increase our ability to excrete these toxins. We can learn how to do this. So let's look a little bit at nutrition and its effect on diabetes. So we looked at toxins and its effect on cardiovascular disease. That's one area of the matrix. So we're looking at the research and filtering the research and our thinking through these different matrix aspects. So nutritional status is very important. One of the key things that's involved in almost every chemical reaction in your body is called methylation. Again, this is something you may not have spent too much time thinking about, but in functional medicine we spend a lot of time thinking about methylation because it's a central switching station for chemistry. Dr. Ho could explain more than I. He's a clinical chemist, but basically methylation, I think of it as like the currency of the body. It's the way in which chemicals exchange information. So when you want to do something in the body, you exchange a methyl group. That's a carbon and 3 hydrogens, and you trade it like trading money. So if that transfer is not working, the economy of your body becomes impaired, right? If you can't methylate, then you can't turn on and off genes. You can't affect the epithelium in a good way that prevents cancer. You can't make neurotransmitters. You can't reduce oxidative stress. You can't make glutathione, which is important for detoxification and as an antioxidant. So you get all sorts of problems, everything from heart disease to autism to depression to cancer to neuropathies to dementia. I had a patient the other day who had a dementia, and it was actually my girlfriend's father, and they were feeling very sad because they realized that soon he would have to be put in a nursing home, and he wouldn't be able to be living on his own, and he was going downhill and couldn't remember anything or how to take care of himself. And I said, well, gee, let's do some testing and find out. Well, it turned out he had methylation problems. He had a folate gene called MTHFR that means that he couldn't methylate as well. And he survived most of his life without having a problem, but as he got older, he needed more help. His homocysteine was very high. His B12, or methylmalonic acid testing showed that he was B12 deficient. So I gave him vitamin shots. And all of a sudden, he perked up. He had more energy. He could remember things. He could have a conversation. He wasn't forgetful. So I look like a hero. But I'm not a hero. I'm just an ordinary doctor who knows some basic chemistry and understands how this plays a role in function, right? A typical doctor would give him an Alzheimer's drug. Also, we know that from the research that many other deficiencies relate to diabetes and heart disease. Vitamin D deficiency, omega-3 fat deficiency, magnesium deficiency, glutathione deficiency. And you'll learn how to boost glutathione. I think you might have learned this from Dr. Roundtree yesterday. Did you like his talks? He gives very good talks on detoxification. And he did all that yesterday, right? So you know about glutathione, and you know the importance of this. Well, the risk of having a heart attack if you have low glutathione was much higher than if you had high cholesterol. But no doctors look at glutathione status. Let's look at omega-3s as an example. You reduce your risk of arrhythmias, so your heart muscle is more stable because the membranes, and again, this is how we think functionally, right? So the cell membrane is made up of fat. You have 100 trillion cells. Every single cell is made up of a fat bilipid layer membrane. Many of those fats should be omega-3 fats. The predominant fat should be mostly omega-3 fats. It creates stability in the membrane. It's flexible, and it reduces arrhythmias. It also is antithrombotic, prevents clotting. It's anti-inflammatory. It's an antioxidant in a way. It improves endothelial function, and it can delay the development of atherosclerosis. So the data is there for us. If we simply look at this research, the problem is that no one's pushing this research. You know, doctors say we should practice evidence-based medicine. What they really mean is we should practice medicine based on the evidence that the drug companies have created using their money to fund studies that support their drugs, instead of looking at the broad array of research out there that many of us are ignoring. So I spend my time, and many of us at the Institute for Functional Medicine spend our time studying the ways in which these various factors that aren't pharmaceutical influence health and disease, like nutritional status. And the research and the data is there. There may be regulating pathways related to appetite and insulin resistance. So often your appetite may be dysregulated, and these omega-3 fats work on pathways in the brain called the endocannabinoid and mesocortical limbic pathways that are appetite regulatory pathways. So maybe you won't be craving bad food if you eat omega-3 fats. It also regulates a key nuclear set of receptors called PPAR receptors that are on the nucleus of your cells that regulate insulin, and they beneficially affect them. So here's an important insight I had. Every receptor in the body is designed for some natural ligand. In other words, there's some molecule in your body or something that you eat that's supposed to go to that receptor, right? It's just logically, you think about it. Drugs use receptors for their action, like a beta blocker blocks beta receptors. Calcium channel blocker blocks receptors on calcium channels, right? So these are drugs which use the body's own pathway. So, for example, Avandia, or the class of drugs that are used for diabetes, like thiazolidine drugs, Avandia, Actos, these drugs bind to PPAR. and they're PPAR agonists. And they work to improve insulin sensitivity and improve diabetes, but they seem to have some weird side effects like causing heart attacks and death. So they seem to do the right thing, but they're really binding this receptor. What's the natural thing that's supposed to bind to that receptor? The natural molecule that's designed to turn that receptor on is omega-3 fats. So that's what we should be taking as a natural PPAR agonist. However, if you look at other fats like trans fat, gram for gram, if you look at trans fat or hydrogenated fat, that also binds to that receptor. So you can have that binding that receptor causing the opposite effects of omega-3 fats. Even though it's calorie for calorie the same, totally different effects. The trans fat will cause inflammation, will cause insulin resistance, and slow down fatty acid oxidation. So it impairs your capacity to burn calories. The omega-3 fats do the opposite. They improve insulin sensitivity. They reduce inflammation. And they improve fatty acid oxidation, so you actually burn calories better. Same amount of fat, totally different effects. So you want to find out, in biology, what are the natural ligands? What are the functional molecules? See, omega-3 fat is a functional molecule that can functionally change the activity of those receptors in a way that the body likes, in a way that the body was designed to function. That's why we call this functional medicine, basically. So, other things, vitamin D, reduction in inflammatory biomarkers in diabetes, improvement in cardiovascular biomarkers like high HDL and reduction in body fat. Let's now we looked at nutrition and we looked at toxins. Let's look at some other areas like structural integrity and intestinal permeability in the gut. This is very important. Most people would not think that trouble in your digestion would cause heart disease or diabetes. What does that have to do with what's happening in your heart? This is the point of functional medicine. Everything is connected. Okay, so watch this now. If you have intestinal permeability problems, you learned from Dr. Hanaway about the gut. The research is showing us that if you have a leaky gut, you can get diabetes. Again, this is not what you're learning in medical school or most of your courses. Impermeability of the gut will lead to bacteria, lipopolysaccharide, endotoxins being absorbed, interacting with your immune system, increasing cytokine formation, inflammation, which then induces insulin resistance. So anything that causes inflammation will cause insulin resistance, even bacterial endotoxins from your gut through a leaky gut. Also, you'll be exposed to food particles, partially digested food proteins that can be absorbed through a leaky gut that your immune system also reacts to, causing increases in inflammation and cytokine production and insulin resistance. So remember, anything that causes inflammation will cause insulin resistance. So aging and chronic disease are primarily diseases of inflammation, even if we don't tend to think of them. Who thinks of diabetes as an inflammatory disease? Most people don't think that, but it is. So there are a lot of things that cause digestive dysfunction. You learned a lot about this. Food allergens and sensitivities, which we talked about, I talked about earlier. Gluten issues we talked about. I have a patient with diabetes, he's celiac. Most of the time we learn if someone has celiac, they're thin and they have diarrhea and they're failure to thrive. No, you can be morbidly obese and have celiac disease and have diabetes, which I've seen in my patients. Bacterial overgrowth, yeast overgrowth, parasites, all these things can lead to these problems. So we call this metabolic endotoxemia. It means your metabolism becomes toxic from these toxins in your gut. So in humans, they found that inflammation causing insulin resistance is triggered by these endotoxemia from the metabolic diet. Now, what causes changes in your bacteria? If you look at the health of your bacteria, It's determined in large part by how you were born, by a C-section or through the birth canal, the health of your mother's flora, and then what you eat throughout your life, and whether you need to take in antibiotics or drugs that disrupt the normal flora like acid blockers and so on that we talked about the other day. So if you look at the flora, if you look at an African bushman, a hunter-gatherer, you look at their bacterial flora and the species and the type of bacteria, they tend to be anti-inflammatory, they tend to be health-preserving. Whereas the bacteria of the average American or person eating a Western processed diet, it changes the bacteria to become more toxic, more gram-negative bacteria, and you get increased endotoxins as a result of eating a high-fat processed American diet. In this one study, they showed that, this was fascinating to me, they showed that they were able to alter gut flora by changing the diet, right after feeding these animals a high-fat processed diet, and it caused increased leaky gut. Then, this was another interesting factor. They just decided, well, we're not going to just change the gut flora, we're just going to take the bacterial endotoxins and we're going to inject them into the mice, see what happens. What happened was that independent of calorie intake, they induced insulin resistance and diabetes. You have to hear what I'm saying here. That independent of what you eat, if you are having toxins in your gut, it can induce obesity regardless of how many calories you're eating. So the whole idea of calories in, calories out, energy balance is really an outdated idea. That your gut bacteria determine how you metabolize your food, how much is absorbed and digested, but also triggers inflammation, which can induce insulin resistance and make you gain weight independent of the calorie content. This is a very big idea. Also, food sensitivities. As I mentioned the other day, there was an increase in food sensitivities in kids who were overweight, and they had increased thickness of their carotids. Probiotics will help to preserve insulin sensitivity. So if you give healthy bacteria, it can help with inflammation and insulin resistance. Also, this is a fascinating study. It sounds terrible, but using fecal transplants. Taking bacteria from a healthy, thin person, putting it into someone with diabetes or prediabetes, you can reverse the effects of insulin resistance simply by changing the flora in the gut when putting a bacteria from somebody who's thin into somebody who's fat. I think that's a good weight loss strategy. Maybe we'll just do a business like that. Shit transplants. Well, you can do it through an enema or you can do it through a nasogastric catheter. You don't want to eat it. But the point is, this is very powerful. So let's look at, we looked at toxins, we looked at nutrition, we looked at leaky gut, all causing diabetes. And we haven't even talked about eating sodas or Cokes or having McDonald's. These are all factors that play a role. And the degree to which they play a role is dependent on the individual. That's why functional medicine is also known as personalized medicine, individualized medicine. In the West, we talk about personalized medicine, and we think of it as pharmacogenomics. Right? I don't like this. This is the idea that we'll use personalized medicine to match the right drug for the person. That's important. We need pharmacogenomics. We need to be able to better prescribe medication so it has more efficacy and less side effects. But personalized medicine is much more than pharmacogenomics. So the link here with inflammation is very key. I want you to understand that the fat cells, these fat cells here that are in your visceral fat, the belly fat, these fat cells are factories that make many toxic molecules that cause disease. Predominantly they make hormones and they make cytokines. Cytokines are inflammatory molecules. So they make IL-6, interleukin-6, TNF-alpha, C-reactive protein. These inflammatory molecules again induce more insulin resistance. They produce the whole cascade that leads to cardiovascular disease based on this problem. they also produce adiponectin, but most of us don't make enough. It reduces adiponectin. This is the anti-diabetes hormone. So, very important to understand that the fat cells that are there are not just holding up your pants, they're actually very active. In one study, they found that if you had high C-reactive protein, your risk of getting diabetes was increased almost 16-fold. That's 1,600%. That's a huge effect. So again, this just goes to show you that anything that causes inflammation will cause diabetes. Also, the opposite is true. Anything that causes insulin resistance will cause inflammation. So it's a vicious cycle. For example, what about gluten? Here's a study from Journal of the American Medical Association showing that even if you didn't have celiac disease, you just had antibodies to gluten, but not full-blown celiac disease with positive biopsy, your risk of having cardiovascular disease was up by 19 to 35%, and your risk of cancer was up 41 to 132%. So this is what we call pre-celiac disease, causing heart attacks and cancer through the mechanism of inflammation. So if you have gluten problems, it can show endothelial dysfunction with celiac disease. Junk food, calorie for calorie. Junk food causes more inflammation than real food. It increases inflammatory biomarkers that trigger insulin resistance compared to just eating traditional saturated fat. Like if you're having pork, which people think is not the healthiest food, but it actually is better than having junk food. So energy, let's talk about energy now. So mitochondrial problems are a key part of diabetes. And everything is connected. So toxins will cause damage to mitochondria. Nutritional deficiencies will cause damage to mitochondria. Inflammation from any cause will cause damage to mitochondria. So mitochondria become a common final pathway for some of the dysfunction that happens in diabetes and aging. I once was at a conference on aging, and there was a man there who discovered the sirtuin genes. Sirtuin genes are the master control genes that regulate aging. And they work by improving insulin sensitivity. So think about it. The genes that cause you to live longer, if you can turn on these genes, you would live 2/3 longer, let's say to 120 years old. If you could turn on these genes, and how do you turn on these genes? By various mechanisms, but the result of turning on these genes is that you correct insulin resistance, that you become more insulin sensitive. I said to him, what is the biggest problem that's causing the problem with these genes? And he said, sugar. Sugar is basically the toxin that's causing more disease. And it's not just calories. There was a study, I didn't include it here because it just came out last week, but it was a study of 175 countries, and they found that if a country increased their caloric intake by 150 calories from real food, there was no increase in diabetes. If they increased their intake of total calories per day by 150 calories, but it came from sugar, there was a dramatic increase in diabetes. So, sugar is a mitochondrial toxin. This is your mitochondria, and a lot of mitochondrial dysfunction is really driving diabetes. So mitochondrial dysfunction is really necessary for maintaining proper insulin balance, and it's mitochondrial dysfunction both in the muscle cells, on the peripheral level. In the muscle cells, mitochondrial dysfunction is related to insulin resistance, and mitochondrial dysfunction in the pancreas affects the beta cells. So early on, you'll get mitochondrial dysfunction in the muscles, which leads to insulin resistance, meaning you need more and more and more insulin to make the insulin work so the blood sugar can go in the cells. And later on, you get pancreatic dysfunction, with mitochondrial dysfunction in the pancreas and the beta cells, so you can't respond by producing enough insulin and you get hyperglycemia. So there's mechanisms that this occurs that are well worked out, but the bottom line is that